Bone bank. Bone bank is a facility in which there is PPSD, that is procuring, processing, storage and distribution of a bone, either from a cadaver or any live donor. Cadaver may vary, you should take remove it as soon as possible, like within okay. And a live donor, during any surgeries, live surgeries like THR from the femoral head, from TKR, from the tibial shavings, and from high tibial osteotomy, the wedges can be taken out. Okay, where you will fill this up. You will do this if you do any large tumor excisions or any complicated articular fractures, or for any extra articular reconstruction when you do a revision arthroplasty. Okay, the protocol which is followed is that any HOD should be from ortho department, a pathologist, a microbiologist, an OT nurse, a lab technician, a bone bank administrator. They all will form a team and an organizational unit. What is the setup made up of? 5 things: ODD, SI, ODC. हाँ, ODSA setup है. Organization, donor selection, documentation, storage and processing, and implementation of it. What are the methods you do? Mostly it is freezing, -20 to -80. Basically it's -80 only. It is used for up to 5 years. Or you can do a defatting, that is freeze drying. Autoclaving and boiling are not done because it will decrease osteoinductive capacity. Cobalt 60 gamma radiation is used for 25 kilo grace. Okay. Rejection is done at a cellular response, so you don't actually see it in person. The ethics which you follow is that you should only use it for a therapy purpose, and you have to screen very well, and you have to take an informed written consent before else. A contraindication will be any viral infection, septicemia, active TB, autoimmune disease, unknown cause of death, or at a donor site if there had been any recent surgery, burns and irradiation. There is no age limit to take a bone graft. If it is less than 45 years, they will have a nice viable cartilage and the osteochondral graft or a meniscus donor. If it is less than 55 years, which no osteoporosis, then you can take a nice large skeletal segments from epiphysis and metaphysis. If it is less than like 65, there is a probability of having osteoporosis, so you can take up only the tendons and the fasciolata. After 65, we don't take a bone graft. Types of grafts which can be taken is a deep frozen allograft, irradiated ones, or a lyophilized irradiated one, or any demineralized bone. You can also use some synthetic substitutes, but it will not have nice integration and sometimes need a secondary surgery. Where will you use it? You will use it to fill the defect, for a structural support, for osteoconductive scaffold and osteointegration. Complication which can occur is an infection, serious discharge, delayed union and non-union. Because it is a non-viable, if you put up in a person, it can have first creeping substitution, inflammation, vascular ingrowth, osteoclastic resorption, a focal nice bone formation and a remodeling. For reconstitution, when you bring it, you should put it in 1 liter of NS with 4 grams of vancomycin and leave it for 30 to 45 minutes.